As you know, the Moose Jaw Health Foundation, sir, has identified some specific gear that will make, well, your life easier and surgery more efficient in our 4 surgical theaters here at the Wigmore Regional Hospital. Filling needs and consulting with the docs, consulting with the surgeons to see what we need. We're specifically earmarking things, and I know that's important to you guys as surgeons, as physicians.
Absolutely. Since starting here, one thing that really stood out, having done all my training, or the vast majority of my training in Saskatoon, is the OR suites. The theaters here are very large, very bright. They have overhead boom lights. Everything is well laid out, and the equipment is second to none. You'd think being in a community hospital versus a tertiary care hospital at the university, that we would be deficient in certain areas, but any equipment that we could use for surgeries we are capable of doing, we have, and it's been really nice. The few things that I was used to using in Saskatoon that we didn't have here, I asked for and I got.
Yes, that's awesome. That's awesome. And that's why we have the Moose Jaw Health Foundation, and that's why we do the Radiothon every year to get the equipment, the world-class equipment for the world-class people here in Moose Jaw. And this year, in case you want to know, May 3rd and 4th, we're asking for your donations for a traveling endoscopy cart, which can move from surgical suite to surgical suite, a glidoscope, which helps the local staff here at the Wigmore Regional Hospital, a defibrillator. I think we all know what that does. It shocks you to get your heart started again. And we have them here, but we need another one. And we've also identified surgical carts to provide surgical teams with quick access to medical equipment used in a variety of surgical procedures. Let's talk about the variety of surgical procedures that Dr. Neuls does for us here on a regular basis.
Well, as a general surgeon, my realm, I like to call it, is mostly in the abdomen. Hernias, gallbladders, sort of the bread and butter surgery for a general surgeon. We do a lot of endoscopy. Part of doing endoscopy is finding things that maybe you don't want to find, such as colon cancer. And I always say I don't want anyone to have colon cancer, but I do like that when they have colon cancer, it's oftentimes something that I can help treat, sometimes help cure, and it's the part of my job I really enjoy. And then there are some other surgeries that we do. Breast cancer is another surgery that is quite prevalent here in Moose Jaw and really everywhere. And it's another one of those things where you have a patient who's terrified because they just heard the big scary C word and all of their worst nightmares are coming true. And for a large number of those patients, we can sit down and have a conversation and talk about curing them, or at least treating them very effectively. And it's really gratifying to see patients who are so appreciative of you helping them through their fears. And unfortunately, there are some people that we can't always help, but or at least cure. But even them, providing that information and getting them on the right path to the treatment that will give them the best quality of life is also really important.
I'll give a little bit.